You all are special right now. You get to.
All right, so I have the notice up on Facebook, and we are recording, so we do have that going. And thank you all for your patience. Thank you so much for being with us today. For those of you who don't know me, my name is Melissa. I'm the Director of Education at the World Erotic Art Museum in Miami Beach, Florida. So Tea and Sex is a series that we typically do at the museum. It would be a monthly discussion series in which we would explore a wide range of topics related to human sexuality. Once the museum closed to the public because of the pandemic, we moved it online and are doing it weekly every Thursday at 12:30 with a different academic, sex educator, or artist giving a talk on, again, something related to human sexuality. The museum is open right now if you would like to visit. We are open 11 a.m. to 6 p.m. every day, but since we still are unable to have large groups of people gather at the museum, I expect that we will be continuing to do this online at least through the summer, possibly longer. So it was called Tea and Sex because we usually have tea available for our guests when they're at the museum. So if you do have a cup of tea to enjoy this talk with, it will be perfect because it's right on brand with the intention of today's talk. So this is a donation-based series. While we're doing it online, it is donation-based with 100% of the donations going to a speaker or an organization of their choice. This week's donations benefit, Dr. Carol Clark was very generous and said, oh, they can benefit WEAM, which we really appreciate, although we are including, instead of WEAM, we would like for donations to go to Dream Defenders, who are fighting for a world without police violence and the prison system. So I am including that link in the chat. I will put it there shortly so it is easily accessible. If you're able to make a donation, that is greatly appreciated. This month we are doing something new, and we're starting with doing a sex positive concept for the week that we're introducing. And the one that I wanted to start with this week is the concept of sexual orientation versus romantic orientation. Oh wait, I need to do this real quick. Can everyone see?
I can.
You see that image?
Yes.
Okay. So this is a concept that I learned about a few years ago watching the documentary Asexual. It's a great documentary. I highly recommend it. It is available on Amazon Prime at the moment, I believe. So the idea of sexual orientation versus romantic orientation, we're usually familiar with sexual orientation, and we understand it as who we are sexually attracted to. But romantic orientation is about who we tend to form romantic attachments with. For many people, their sexual orientation and their romantic orientation can be the same or very similar, but that's not necessarily the case. People can be bisexual and heteromantic. They can be asexual and aromantic. They can be homosexual and homoromantic, or heterosexual and panromantic, or any other combination of the two. So that is what I wanted to share with people today. And from there, we can move on to our guest today. We are very fortunate to have Dr. Carol Clark with us today. Dr. Carol Clark is incredibly knowledgeable. I'm always impressed at just how much information she has to share. We've done several programs at the museum in the past. We've done several Ask a Sexologist events at the museum. So Dr. Carol Clark has her doctoral degree from the American Academy of Clinical Sexologists and the Institute for Advanced Study of Human Sexuality. She's a certified addictions professional. She's opened up a number of organizations. She's opened up the Addictions Therapy Training Institute, the Sex Therapy Training Institute, the International Transgender Certification Association, and most recently in 2016, the International Institute of Clinical Sexology. She's the president of the Therapist Certification Association and the author of Addict America, The Lost Connection. So please welcome Dr. Carol Clark.
Thank you. All right, so thank you very much. I'm really happy to be here. This was going to be an hour presentation, and it still probably will be, so I hope you all can stay on. And we are recording it, so we'll just keep recording to the end, and if you miss any, Melissa will tell you where to find that. So I'm going to share my screen now, and hopefully, and now I'm going to go into slideshow mode from the beginning. There we go. All right. So today we're talking about internet porn addiction, and somebody pointed out the need to say I am not opposed to porn addiction. I am not anti-porn addiction. But what we're going to talk about is addiction and how things can be addictive, including porn, even things that are otherwise healthy. So Melissa already told you a lot about me. One of my books is Addict America, The Lost Connection. I just published another one called My Pocket Therapist, 12 Tools for Living in Connection. And then those are all my schools. And I also have a bug named after me. So I throw that in because it's so special. Ozafra Karali, from a past life when I worked for an entomologist. So internet porn addiction. You can get anything on the internet. Dates, vitamins, theater tickets, airline tickets. You can watch a whole talk about porn addiction on the internet. And then there's porn. Okay, so there's tons and tons and tons of porn. And porn traffic is flowing through the internet 24/7, and especially during work hours. So what happens is anything, anytime leads to addiction. If you do a lot of something, you get addicted to it. And addiction interferes with relationship. It clouds our judgment. It sucks out our souls. So what? So we're going to talk about this and how it affects you and what you can do about it. And if you think it's not affecting you, well, think again. Because look around your coworkers, bosses, friends, even your children, your partners, everyone. It's affecting some of them and therefore your relationship with them. And that's what we're going to talk about today. So the definition of addiction is obsessive, compulsive, out of control behavior done in spite of negative consequences to self or others. Now you'll notice in that definition, it doesn't say anything about a drug of choice or a behavior of choice. It simply describes a state of being where someone is obsessing, they're compulsive in their behavior, it's out of control, becomes out of control, and it causes negative consequences. And sometimes people don't recognize the negative consequences to themselves in the moment, but it's still causing negative consequences to others. And so my way of looking at addiction, which is where I came up with the Addict America concept, is we get addicted to stimulation. We get addicted to reaching outside ourselves for relief of pain, to escape, which ties into the trauma model of addiction. We're going to talk about that a little bit more in a minute. But it doesn't matter what drug you're reaching for. It doesn't matter whether you're reaching for sex or porn or cocaine or alcohol or gambling or shopping. It's not about a drug of choice. It's about the addictive process. So we have a couple of models of porn addiction, and one is the trauma-based model, and the other is the intensive use-based model. So this particular graphic here, I created for the trauma-based model. And it shows how addiction becomes a barrier to intimacy. And what happens in trauma-based addiction is in the middle, if you look in the middle, you can see a father is yelling and shaming his child. And so that's where there's a disturbing event, which leads to a negative belief. Where, like, and I know you can't see it too well, but I'm not important, I'm worthless, I'm not good enough, I'm a bad person. So kids take in these negative beliefs from their parents and the world around them when they're children, and they're just learning things, and the world revolves around them. So everything is about them. And so these disturbing events actually become traumatic. You know, even if we look at it as a parent or as an adult, and we say, well, you know, what's the big deal? We may even, as adults ourselves, we minimize things that happen to us in childhood, or we recognize that maybe our parents did not mean to be belittling or putting us down. They might have been trying to motivate us. So if you have the kid that comes home with a B on a report card and the parent's like, hey, what's this? I know you can do better. You can get an A. You know, this isn't good enough. You got to get an A. And the way the child takes that in is, I'm not good enough. Love is conditional. I'm not going to be loved unless I am good enough. And so now I'm not lovable because I'm not good enough. You see? And so that becomes very traumatic for a child, but as adults, we tend to minimize those events. Nevertheless, it's a disturbing, these events are generally not a one-time event. However your parents are treating you, it's not a one-time thing. It becomes a pattern of behavior. So the child takes in this negative cognition, which leads to a fear of intimacy. Because if you believe you're unlovable and you're not good enough, then you're going to try to control how close you get to other people so that you are protecting yourself so they can't hurt you. See, so we go from fear of intimacy to controlling the distance. And then that leads to pain of disconnection, because we do want to be connected. We want to be in intimate relationships. It's our nature. That's our spiritual nature. It's the nature of the universe that all life is connected. There's an electrical connection. The Higgs field, for anybody who's into physics. So that pain of disconnection then leads to mood-altering substances or behaviors. So if I'm a kid who's growing up and thinking, there's something wrong with me, I'm not good enough, I'm never going to be in a really close relationship, or I'm trying to control how close I get to someone else in relationships. And then I'm online and I discover pornography at a time when my hormones are racing and I'm feeling very sexual. And now here's this whole world that I can control, and I can be sexual, and I can engage in pornography and feel good. And so I get that double whammy of feeling really good and escaping from pain. Pain that it's unconscious. That's an unconscious process. I'm not aware of that pain, but it's kind of like hearing a jackhammer in the background. And you kind of zone it out until it stops. And then you're suddenly aware of it, like, ah. And you have that relief. And then if it starts up again, now you're hyper aware of it, and it's like, ah, and now you'll do anything to make it stop again. So when you do a drug or a behavior like looking at porn that gives you that relief, you become aware of it. Again, it's not necessarily a conscious awareness in the prefrontal cortex. It's back in the limbic system. So, but then you're going to want to do the same thing again. So it's not just seeking out that drug or behavior like porn, just to make you feel good. It's also coupled, paired with the relief of pain, the pain of disconnection. So you do more. But then the way the brain is, the limbic system needs more and more and more, because it keeps readjusting. It's 5 million years old. So it keeps readjusting to how much stimulation it's getting. And if it's getting too much, if it's getting flooded with stimulation, say from porn, then it's going to create a higher baseline of how much it needs to feel just to feel normal, and therefore you need more in order to feel good, to notice the effect, you see? So that's what we call tolerance. So you need more and more and more. So just to compare this and going to that, I'm not anti-porn. In the grand scheme of things, if you're a person who's growing up and you discover porn and your life is otherwise pretty balanced and you're feeling okay about yourself and you discover porn, it's like, hey, this is really cool. And I enjoy this. And it becomes just another thing in your life you enjoy. So we try out all kinds of things that we enjoy in our lives. And a lot of those things have the potential to be addictive, but they don't always. So we can try a drink. We might even, as teenagers, as young people, we drink too much. And then we learn, okay, I don't have to drink that much. We might try different drugs. Okay, we can try out different behaviors. And kids generally do go overboard. And then they come back and they are fine. And they don't become addicts. And then they can enjoy porn. They can enjoy a drink. They can enjoy, smoking a joint. They can enjoy gambling, playing a game, having poker night once a month, going to the casino occasionally. They can enjoy those things without being addicts. But when it gets paired with that escape from pain, then it has the potential to be addictive, and often is. So that leads to addiction, which leads to barrier to intimacy, because when you are in an addictive state, you're always thinking about, when am I going to get high again? I need more. And that's always going to get in the way of your relationships. Your relationship is not primary. And you can love someone, and this is where a lot of partners, children of addicts will say, hey, why don't you love me enough? If you love me enough, you would stop doing this. But it's not about that, because those words are coming from the prefrontal cortex, the thinking, reasoning, logical brain. And the addiction is back in the limbic system. That's from childhood. It's keyed into our survival, because things that make us feel good, we do more of. Memory is back in the limbic system, so we remember what feels good. And emotions are back there, so we feel good. That's where our feeling good comes from. So all that addictive stuff is back in the limbic system, and it's unconscious. So it's not, I can say, I love you so much. And if I'm an addict, I'm still going to be wanting to escape into addiction, into my addictive behavior. Any questions about that so far? Anything coming up on the chat? So where do we go with that? So you recognize, okay, I'm in addiction. I'm living in an addictive place. And it's interfering with my relationships. It's out of control. I've tried to stop and I can't. I'm obsessed. I'm doing it all the time. I'm doing it when I don't want to. And I'm thinking about it even when I'm trying not to think about it. So now I'm ready for help. I'm ready for recovery. I'm ready for an intimate relationship, to be capable of intimate relationships. And so that's when we go into recovery. And recovery is about being present, not always looking to the future of when do I get high again. Recovery is about being able to allow feelings. So all those painful feelings from childhood, I can tolerate them now as an adult. And sometimes that takes a lot of therapy. I do something called Emdr, eye movement desensitization and reprocessing. And what that is it uses bilateral stimulation, so either audio, tactile, or eye movements, to provide bilateral stimulation, which reprocesses those early memories from childhood, so that it turns them around from I'm not good enough to, you know what, I'm okay with myself. It's not talk therapy. Talk therapy doesn't get back into the limbic system. So you need some kind of non-talk therapy to really help with this. Behavioral work helps as well. Changing behaviors can have a strong effect on the limbic system. So recovery is being present, being able to handle the feelings, the emotions, and really connecting with yourself and connecting with others, and being able to connect, truly connect, not be out here trying to control how close you get to someone. So then we move to making a decision. Everything, when you choose to be in recovery, then you ask yourself, is this for my addiction or is this for my recovery? Every question that comes up, every decision you need to make, you go to asking this question to make a decision to be in recovery. So it might come down to when you're saying, gee, I really want to look at porn. Porn can be healthy. Porn can be happy. I can do this. You might come to me and say, hey, Dr. Clark, you know, we've been working on my recovery for a while. You know, I really think I've got this addiction thing handled. And, you know, is it okay if my girlfriend and I watch some porn together? I don't know. Ask the question. See, this is where I can go to this. I'm going to ask you, is this for your addiction or is this for your recovery? And you will know when you're in a good place of recovery and you're really in touch with yourself. You have that little voice that's never going to lie. You might not like the answer, but I don't have to tell you whether it's for your addiction or recovery. You're going to know. And then you just do it. If it's for your addiction, you're not going to watch porn. If that's going to take you off back to a place that you don't want to be, you don't do it. You find other things to do. Now, it could be you find other types of porn. It might be being with your girlfriend allows you to not go to that addictive place. I don't know that. You know it. You know it. You have to know that. So we're going to retrain the limbic system for recovery. And there's a lot of exercises that are in that book, 12 Tools, My Pocket Therapist, 12 Tools for Living in Recovery, in Connection, Living in Connection, but it's all recovery tools. So things like heart hugs and eye contact that helps regulate the limbic system. Because the limbic system, remember, is also where it's survival. So fight or flight. When it's activated, because it has to assess danger and it goes into a fear place, it shuts down the prefrontal cortex. And then we can't make good decisions. So whenever you hear someone say, how could you be so stupid? Okay, you're watching porn on your work computer and you get caught. And somebody says, how could you be so stupid? You know that they're monitoring all the computers. You know they're going to catch you. It's not about being stupid. It's because your addict brain, there's someone who's an addict. See, because their addict brain was activated in that survival mode. It doesn't sound like how could watching porn be keyed into survival, but it's that part of the brain that shuts down the ability to think. So it's not about being stupid. It's that this person could not think in that moment and didn't care. So we have some of the other limbic system recovery exercises, appreciation exercise, just to show appreciation to the universe for what we're given and for what we have to give. And doing orientation exercises that allow you to orient to your environment so you can actually assess, is there danger or not? And that helps train your brain to calm down. Learning to be intimate in other ways than sexual. A lot of people think that being sexual is how you be intimate. I like to turn that around and say, let's be intimate. Let's be intimate in affectionally, socially, recreationally, spiritually. Okay. There's a lot of other ways to build intimacy, and then sex becomes one expression of that. And that's one of those tools. So a lot of this, this is all contained in Addict America, The Lost Connection, which is a really good book for everybody, not just for addicts, not just for people who identify as addicts. It's great for therapists who work with addicts, and it's good for everybody in general who doesn't even think they're an addict, or who has an addict in their life, and they can share the book with them. So there's a great website called Your Brain on Porn. And they have a lot of studies listed that link porn use, porn addiction to sexual problems and lower arousal to sexual stimuli. So now we're moving into, I'm going to talk about how does porn addiction affect us sexually. So there's a lot of studies about this. When you are watching porn, you're engaged in using your drug of choice. And when you're doing that, you're not engaged with a partner, for instance. You're not engaged with your children. You're not engaged with your friends, unless you're all watching porn together. So this is one of the ways that porn can be addictive. And you know it's addictive because if you have someone who says, I love my partner. So I can be sitting here saying, you know, I love my husband with all my heart. He's my best friend. I want to be married to him. I want to be with him. And then I turn around and I'm watching pornography rather than being with my best friend, rather than having sex with my best friend, my husband. Okay, so I'm making this choice that keeps me disconnected from an intimate relationship, an otherwise intimate relationship, so that I can be engaging in my drug of choice. And honestly, you can see how it wouldn't matter if I'm sitting here in a, huddled in the closet doing cocaine or drinking or watching porn or on the internet gambling or secretly eating, getting up in the middle of the night and eating. I'm doing something that is disconnecting me. And so what happens is, remember I said in that graph that an addict is going to deliberately stay disconnected, try to control the intimacy, the level of intimacy. And when I say intimacy, I'm not just talking sexual intimacy, I'm talking about connection, okay? So when I'm deliberately trying to control how close I get to another person, especially an intimate partner, okay, how do I do that? Well, what happens is it's not just saying, oh, not tonight, I don't feel like having sex, and then I go off and watch pornography and masturbate. But for males, and this is a lot for males, they're going to have erectile dysfunction. So I like to say when I'm talking to people, students or clients, that our bodies speak for us and our genitals speak for us. And one of these days I'm going to get little hand puppets to demonstrate that. So if your penis, it's speaking for the limbic system. So the penis is saying, nope, don't want sex. Don't want to be that close. The penis's behavior is disconnecting, right? So there's also the aspect of what turns us on. And when we get conditioned to be turned on by porn, by the behaviors we see in pornography, by the bodies that we see in pornography, and when our brain gets conditioned that, oh, I see this, it turns me on. Then when I see my partner's not a porn star, nor is my partner airbrushed, nor is my partner showing me the camera angles that we see in porn, right? I don't have any of that. I have a real living, breathing, honest body here with me. And that's not going to turn me on. All right, so because my brain is conditioned for this. Was there a question? Did I see a chat pop up?
Someone saying hi.
Okay. So what we have is a lot of studies that show high correlation, high levels of porn use are correlated to, and even the cause of, a lack of sexual desire for a real partner, a lack of ability to get erections, okay? And so a poor sexual or relationship satisfaction. Okay, and here's over 80 studies link porn use to poorer mental, emotional health and poorer cognitive outcomes. Here are some more interesting statistics. Now remember, I just put this slideshow together recently, so Forgive me if I might be getting ahead of myself. We talked about the trauma basis of addiction, but there's extreme use, okay? Extreme use of pornography. So we have this new phenomenon now around the world, because anybody can access porn, except maybe a few countries, but for the most part, you can access porn anywhere, anytime, tons of it. And so what happens is you have an otherwise happy, healthy person, kid, usually boys. Boys are more generally, in general, okay, are going to be more visually oriented. They see something that turns them on. And when I say something, I mean they see breasts, they see vulvas, they see butts, turns them on, okay? And then they start becoming fixated on that. And when they're exposed to porn, which they are, because everybody's carrying around smartphones, and if their parents don't let them have one, well, all their friends have them. So they start looking at porn, and then because of how much there is, they become addicted, okay? So there again, here's, without the trauma basis, we still have that phenomenon of getting way more stimulation than what I call the caveman brain. Forgive the gender, there's no gender bias, it's just a name. We have a caveman brain that is 5 million years old. It's used to a certain level of stimulations that make it feel better, make it feel worse, okay? And what it does is it's going to readjust by, for instance, if you do a lot of anything, cocaine or porn, that's shooting out a lot of dopamine, it's going to close off dopamine receptors so that you don't get as high, okay? And so just all other things being equal, just watching a lot of porn, just like if you did a lot of cocaine, you can still get addicted without the trauma basis, because the brain is going to readjust. You're going to remember how that rush felt, and you're going to want more, so you go for more, and you go for more and more and more and more and more. And then because you're spending so much time, so just imagine an adolescent boy sitting in front of the computer on their phone, looking at porn, and what are they doing? What are they not doing? They're not socializing. They're not dating. They're not interacting with anyone, male, female, other. They're not interacting in ways that help them develop real life relationships. They start, so that now they become socially regressed or delayed because they're not engaging in the relationship building and discovering that is typical and part of the developmental process for teenagers. So they're bonding with the screen, they're learning that this is what turns me on, they're getting conditioned, and they need more and more and more. So what we have is this whole generation, a couple generations now, of mostly boys and young men who are conditioned to porn, and they can't have real-time relationships with real people. And so we've had a lot of studies now showing this. So 20% of porn watchers from the ages of 18 to 25 think it has affected their ability to have sex. And 30%, 18 to 24, had erectile dysfunction. And here in Brazilian study, men 18 to 40, erectile dysfunction at rates of 35%. Okay, so look at these statistics. This is staggering. This is what in the past we would see with, men over 60. Now we're seeing it in men during the prime sex years of their lives. So what else do we have? Here's active duty, relatively healthy male military personnel, aged 21 to 40. Erectile dysfunction at a rate of 33%. And a Canadian study of adolescents, 53.5%, age 16 to 21, have symptoms indicative of a sexual problem. Erectile dysfunction was the most common, 27%, followed by low sexual desire, 24%. So, or problems with orgasm, 11%. This is staggering, okay? So what's happening, they're getting so much into the porn, they don't know how to have relationships, they don't want to have relationships, they don't find partners, male, female, other, whoever they're attracted to, or just, they're not attracted to, okay? They're just not attracted, doesn't do it for them. And so they avoid relationships. And then they start saying, wow, maybe I have a problem here. Maybe this is a problem. So here's high school seniors, 18 to 19. 16% of those who use porn more than once a week reported abnormally low sexual desire. One of the things that's not here in this study, and by the way, I have this in a PDF, and I'm willing to distribute it, make it available to you. So I'm not sure how Melissa can make that happen, but if you contact me, and Melissa will give you my email, I'm happy to email it to you. So you can get these statistics, or you just Google them. You can find them easy enough. One of the things that's not on here is in Japan, there's been a huge dive in reproductive rates because boys are not leaving their rooms. They're not getting married. They don't want to have sex with women. And so they're not getting married. They're not having kids. Now, in a world of overpopulation, maybe this is nature's way of curbing the overpopulation problem. Everybody's just going to watch porn, not going to reproduce, and we can drop our numbers by a couple of billion and keep the planet healthier. But I digress. All right. So here's a really good article, Neuroscience of Internet Pornography Addiction. Now, I said that I would talk a little about the controversy about sex addiction in general, porn addiction specifically. I'm a sex therapist. I'm also a sex addiction therapist. I treat sex addiction, and I treat all kinds of sexual disorders and dysfunctions. I have a lot of experience and education around both these areas. So what I've seen in these communities, there's the sex therapy community, which has we have a listserv, and and then we have the sex addiction community. And the sex therapy community's history comes from, there's people who have been pioneers in the field of sex therapy in a world where the dominant culture, British culture, Spanish culture, so I'm not talking, so Asian cultures are different, Jewish culture is different, but Christian culture has been very disaffirming of sexuality. And we know, so for those of us in this country, the United States of America, we have this love-hate relationship with sex. We're very punitive around sex. We're very repressed. We're regressive. We don't talk about it. We don't teach it, certainly not effectively. There's lots of laws governing sexual behavior. There's what do we have access to regarding sexuality, learning about sexuality, just exposure to anything sexual. And even to the point where we still have a lot of municipalities where abstinence only is taught in schools, which is just insane. That's the world we live in. Our country is very mixed. Then on the other hand, we have sex cells. We have sex everywhere. We have access to unlimited pornography. We have our media that's just all about sex. Okay, so there's this love-hate relationship with sex. And so the original sex therapists and a lot of current sex therapists certainly are very sex positive, myself included, very sex positive. What we want is healthy sexuality. What does that mean? Well, sexuality that doesn't cause significant distress, that is not exploitative, that is not addictive. Okay, except there's a whole faction of sex therapists who don't believe in sex addiction because they see sex addiction, or people that call it sex addiction, as being trying to repress healthy sexuality or a variety of sexual expression. And I'm here to tell you that is not true. That is not true. Okay, sex addiction therapists, responsible, well-educated, ethical sex addiction therapists are not trying to repress anyone doing anything. What we're trying to do is look at how can you do whatever it is you do in a happy, healthy way, where you're connected, where it's not obsessive, compulsive, out of control behavior done in spite of negative consequences, self or others. Okay? So you can be into BDSM, you can be into non-monogamy, you can be into any number of fetishes. That's fine. Go, have fun. Watch porn. Have fun with it. Okay? Except when it becomes obsessive, compulsive, out of control behavior done by negative consequences, self or others. Now we have a problem. And look, I'm not out in the streets rounding people up saying you're a sex addict. No, you're coming to me. You're looking for me because you think you have a problem with porn or with other sexual behavior that's fitting that addictive definition that I use. Okay? So unfortunately, what's happened is with this whole anti-sex addiction and anti-porn thing, they don't look at it, those people don't look at it rationally. They don't look at it, and some of them are selling something. They're selling anti-sex addiction books and whatever. Or they truly believe, they have this mistaken belief that, sex addiction therapists are not into positive sexuality. So whatever the reason, it's held back sex addiction from being called sex addiction. It's held back from being included as a diagnosis, which would mean that if you identify as a sex addict and you come to see me for therapy, you can't use your insurance. I don't take insurance, but that's beside the point. The fact is, you can't use insurance because it's not going to be reimbursed because there's no diagnosis. Okay, so there's been, what the sex addiction side of the fence people are trying to do is, there's tons of research. The anti-sex addiction people say, oh, there's no research. It's ridiculous. There's tons of research. Here's one article that Todd Love and these other people have done, and comparing internet addiction to internet gaming disorder, and looking at it as the same things happen in the brain. So going back to the brain, that limbic system, what happens? You get exposed to some stimulation. The stimulation causes firing of dopamine. When you start doing more and more over a period of time, your brain is going to change, and it's going to shut down those dopamine receptors, so you need more to get the same effect. It becomes obsessive, compulsive, out of control behavior done by consequence, self or others, right? Okay, so here's just one of many articles that is really looking at what's going on in the brain, what is the, because internet gaming disorder, because gambling are being looked at as addictive behaviors, the sex addiction people are trying to show, and porn addiction and internet addiction are trying to show there's a real similarity. It's just a different drug of choice. So, one of the last points I want to make here is religious shame in porn. So another thing that anti-sex addiction people like to pull out, and it's something worth looking at. For those of us who treat sex addiction and porn addiction, we do assess, we do evaluate when you come see me, what's your problem? How is it a problem? What's going on for you? So I'm really looking at doing a whole assessment before I try to label you, and I'm probably not going to label you. I'm going to give you the definition, and you're going to say, does it fit? So what we have here is, there is a segment of the population who, because of religion, usually because of religion, repress sexuality. I already mentioned that. Abstinence only. They have a whole laundry list of sexual behaviors that are not permissible. And they say it's in their religion, although when you look at religious books and scriptures, it doesn't really speak to any of it. But there you go. So here is one article, Moral Incongruence and Pornography Use, a critical review and integration. Moral incongruence, what this is saying, and pornography use. So we have people that, and again, usually men, but sometimes women, who say, have this idea that, oh my God, I'm watching porn. I have this desire to watch porn, but no, it's bad and I'm shameful and there's something wrong with me. And, oh, I must be a sex addict. Or they go see someone who says, well, it sounds like sex addiction or porn addiction. And they're like, oh, okay, now I have a name for it. Let's fix it. Now, the abstract for this article says the present work reviews evidence that moral incongruence about internet porn use is a common phenomenon and that is associated with outcomes relevant to current debates about pornography addiction. Specifically, moral incongruence regarding IPU appears to be associated with greater distress about IPU. So we can have a lot of people who are saying, you know, I look at porn, I like porn, it enhances my sex life, it's something I like to do, it's not a problem. But then we have a person who is very religious and they think that doesn't fit with their religion, and so it causes them a lot of distress. So this is saying greater psychological distress in general, greater reports of problems related to internet porn use, and greater reports of perceived addiction, IPU. Okay. The thing is here, if you belong to a religion that says don't look at porn, so I forget whether it's in the Bible or not, but your religion, you belong to this group, says it's not good. You are morally abhorrent if you look at porn. And you choose to look at porn. Well, some people in that religion are going to look at porn and they're going to be like, you know what? I know my minister, whoever, says don't look at it. Maybe, you know, some of the other people in my congregation would say I'm you know, morally degenerate because I'm looking at porn, but I'm going to look at porn anyway because, you know what, I don't think there's anything wrong with it. And that's not somebody that's coming to see me, and it's not causing significant distress. What we have is someone who is looking at it with a belief that it's wrong, with a belief that they would be shunned by their community, that maybe they're going to go to hell, I don't know. And so here's where it gets interesting, because the anti-sex addiction people are going to say, well, here's a person that's going to identify as a sex addict when really it's their religious shame. It's their shame for doing something that is at odds with their religion and their religious beliefs. I'm going to say, if they believe it's wrong and they're doing it anyway, doesn't that become obsessive, compulsive, out of control behavior done in spite of negative consequences, self or others? So you can chew that over. So internet porn, healthy or destructive? Does it cause significant distress? Is it out of control? And then how do we address it? And however you're coming at it, whether you call it an addiction or not, I don't care. It's something that's causing you distress. And so recovery interventions work. And that's when we get back to some of those things on that graphic that I showed you. I talked about limbic resonance, the eye contact, the heart hugs, appreciation. That's why I ended up writing my Pocket Therapist, 12 Tools for Living in Connection. Recovery is not about deprivation. It's not about taking something away, stopping it, depriving yourself. It's not about not doing porn. It's about, what am I going to do instead? How do I want to live? So choose who you are. What kind of person do I want to be? I get to choose. And how do I want to live? So I have people do a vision board to really make that substantial, put it in front of them. And we can't put a not, a negative, on a vision board. We can only put things that we want. We can't put things we don't want. So we're not going to put porn on our vision board and say, oh, I don't want this. Well, you know, law of attraction. So what are we going to put there? We're going to put all these things, and I have all these wonderful exercises, excuse me, in this book. It's just exercises I give to my clients all the time, and I finally figure, okay, let me write it down for them. And it has a little workbook at the end. So when you're doing all these exercises, you're living more in recovery than you are in addiction. And that's what we can do. And whether you call it addiction or you call it recovery, you can call it whatever you want. When you're living in harmony with yourself and doing these things that help you do that, you're going to feel better. You're going to be more able to be in intimate relationships, connected place. There's a few more resources for you. And here's me. I'll leave this up for a moment. So there's my contact information. So you can contact me for anything, you know, if you want to take my program, if you want to just get the copy of this PDF. There you go. So questions, comments?
Thank you so much, Carol. We do have already several questions. So let me go. So the first one we had was, how do you handle all of the potential confounds that may be related to erectile dysfunction, such as this is a long question, such as the proliferation of endocrine disrupting chemicals and plastic-like estrogens throughout our environment? Have you used modeling that accounts for other reasons? Similarly, how do you know that these are related to porn and not increasing rates of obesity, diabetes, and cardiovascular disease in young adults?
I'm going to assess for that. I'm going to ask people about their, you know, as I'm doing an assessment. If you come into me to see me and you have erectile dysfunction, the first thing I'm going to do is send you, it might not be the first thing, what I'm going to do is ask you, do you wake up with an erection in the morning? Do you get erections throughout the night? Do you ever get erections? And if you tell me you get erections, then okay, that means your erectile dysfunction is situational. It's not generalizable. So then we're going to ask about what's going on in those different situations. If you're not getting erections during the night, not having them in the morning, just not having them, I'm going to send you to a urologist to have an endocrinologist, have your hormone levels checked, have a good medical exam, see if it has a medical basis. And it could be you had some kind of medical basis for erectile dysfunction that then caused so much anxiety that now you're creating the problem because your anxiety is coming up every time you want to engage in sexual behavior. And then we'll deal with the anxiety. But I'm going to ask questions about your sex life and about your masturbation life and about your porn, how much porn you look at. And so I'm doing a comprehensive evaluation, and then I'm going to say, hey, you know, you tell me you're masturbating to porn 3 times a day. And do you feel, you know, that sounds like it could be addictive, that you have an addiction going on. Here's the definition of addiction, which I've told you about 5 times now. So does that sound like it fits for you? And the person is going to say yes or no. And sometimes people say, oh, wow, yeah. And some people say, okay. So we can still say, how about let's give pornography a break for a month and see what changes. And let's work on some other things, interventions to deal with your erectile dysfunction. And let's remember too, that the be all and end all of sexual activity is not the penis, an erect penis. There's a lot of things people can do that are sexually gratifying, either alone or with a partner, that don't have anything to do with an erect penis. Okay? We don't want to make the penis the be all and end all of sexuality. What's next?
So there was a question, what do you think of the men going their own way internet movement? It is trending all over the web.
Men going their own way, and okay, well, I don't follow trends. You're going to tell me more. I know you're thinking, oh, she should know that. No.
I believe it's related to the men's rights activists.
Okay, I still need more. What is it about
It
this?
is men disappointed because of divorces.
Yes.
Yeah, that is it. The men's rights activists, I think.
I don't know. I'm still not sure what it is you want. Yes, it is against misandry. So is this like dealing with masculine toxicity, or the idea? I'm still
No,
not
I don't
quite.
think it's about toxic masculinity. I think, although it's about toxic femininity.
Toxic femininity? Look, there's a lot of our country in general, people in general have ideas about male-female stereotypes and behavior, how we're supposed to, and that "should" is one of my bad words, is in my book. And hopefully, yes, you'll put those links on Facebook on the WEAM page, as David is asking. When we try to adhere too much to the way society or religion or our families say we should, that becomes somewhat traumatic. And so what I do is I look at people individually and say, let's look at how this is coming up for you. Let's reprocess with Emdr. Let's talk about it. Let's change some behaviors. Let's explore what's going to be. There's an educative process to therapy that I engage in to help people, get in touch with what's going on and make better decisions, or make different decisions, whatever's better for them. So certainly males and females both are conditioned by the world we live in to believe that we have to behave in certain ways, that the other gender has to behave in certain ways. And that can become very toxic when we want to be outside the box, when we objectify others and we objectify our partners. If we have a bunch of boxes to check off, this is how you should be, this, and this, you're objectifying a partner. That's not connecting. That's just, then that goes to the person here is writing about sex dolls. Mm-hmm. Yeah, sex dolls are a way to have sex with. It's a way of controlling intimacy. So on the one hand, if you have a nice relationship with your sex doll, and that's your significant other, and it's working for you, you're not coming to my office. So, have fun. That's your relationship. The person that comes to my office is somebody it's a problem for. And then we're going to look at, what is it that you want? And what are the barriers to you getting what you want and being in the kind of relationships you want? And certainly somebody using a sex doll, if that's your thing once in a while, you do it. If you're living with your sex doll, and it's fine. But if you're feeling an emptiness and a lack of connection, and you're recognizing that and feeling lonely, and that's an escape, and you're trying to control intimacy, then let's look at that. Let's approach that therapeutically and remove the barriers to intimacy.
We have a couple of other questions. One that was a little bit earlier. Why is misogynist, racist porn among the most popular kinds of porn being used today?
It objectifies. It's a way of controlling intimacy. When I look at you and you look at me, and right now I'm looking at a camera, but I've actually noticed that when I talk to people and I'm looking in the camera and you're looking into my eyes and I'm aware of that, there's a connection there. When you're listening to my voice and you're with me, there's a connection. If that scares you, if you start getting nervous and uncomfortable in ways that you're not even aware of because it's happening back in the limbic system, then you're going to try to objectify me. You're going to try to control me. You're going to try to control how close you get to me. And so you're going to call me names. You're going to behave in misogynistic ways. You're going to be trying to put me in some place where you get to control the connection where there is no connection, because now I'm an object. And so that becomes very popular for people. And in today's world, it's just, that's what we're all doing with this. There's a lot of hatred and racism and bigotry and misogyny, and a lot of things are coming out in today's world, because here's a quick answer for you. The biggest motivator of human behavior is the need to belong to the group. Belonging to the group is keyed into our survival, and it really motivates everything we're doing. So, for instance, just pulling from what's going on in the world today, we see groups. We see the police as a group. And for those of you who saw the video of the 75-year-old man being pushed down, and what happened, we had this group, we have the group of police who, certain groups really work hard to make sure that you belong to the group and you don't deviate from that group. And what happened was, you saw the one officer push the man down, and another one went to check on the guy, went to help him up, and the one that pushed him down pushed him away. And then if you really look, you can see on his face this look of just pain and confusion, like, I want to help, but I can't help. Because he needed to belong to his group. He has to belong to the group. You see? So just that's one example. So individually, people behave very differently than they do in the group, and how they're going to appear in a group. Because exile from a group can mean death. It's the matter of survival, because the limbic system doesn't know that this is 2020. It doesn't know any of that. It's still functioning on those, primordial days where you got to belong to your group to survive. Okay, so how do we get around that? We plan. We make decisions. We go back to doing our vision board. What kind of person do I want to be? And what kind of groups? There's nothing wrong with belonging to a group. Just choose what group you want to belong to. So, but what kind of person do I want to be? And then behave congruently with that view, with that how you want to be. And then no one can control you. No one out here can control you. You can control yourself, which goes to the serenity prayer. God, grant me the serenity to accept the things I cannot change. That's anything out here. The courage to change the things I can. That's me. And the wisdom to know the difference.
I think we have two more questions. There was one in a similar vein. From a non-religious, non-morality-based perspective, what about the ethics of using porn that degrades Latinas and Black women and depicts women being choked and strangled, because those are incredibly popular genres? So now you're getting, so you see how like 1 hour is not nearly enough to delve in all these things. So then we have, so on the one hand, we have, okay, watch porn, happy, healthy. And in fact, I sat at WEAM with 2 porn actors who embrace doing porn. They love doing porn. It's what they do. They're happy, healthy. Okay, so watching them do porn, I think we could do that without any sense of guilt or shame. And then we have the whole porn industry, which we know is rife with abuse, with exploitation, with torture, with slavery, okay, with owning human beings, the sex slave trade. So now we get into, okay, can you, knowing this, watch pornography and enjoy any part of it, knowing or not knowing if the actors you're watching are doing this because of their own volition, because this is what they enjoy doing, this is how they've chosen to earn a living, or because they are basically being exploited in some way. If I want to add in a couple of things. So a couple of different things. So first of all, there is absolutely a racism problem in porn, like without a doubt. That is a big, big issue. And we can be anti-racism in porn without being anti-porn, because it is an issue that exists within the porn industry without a doubt. In addition, and this might seem like a subtle distinction, but porn is not inherently bad, it's not inherently negative. There is a lot of porn that exists that is terrible. absolutely, that is misogynistic, that is racist, that is violent, that is all the things. But that is due to the people who are creating that particular porn and not inherent to porn itself. I can tell you that working at an erotic art museum, there are pieces in the museum that go back as far as 300 BC. So creating erotic imagery is something that has always existed, and any technology that develops over time is always at some point used to create erotic imagery. And so there is absolutely porn that exists that is healthy, feminist, sex-positive porn. It's not as widely available and not as easily to find as like all the terrible porn that exists right now, but it is out there, and it does exist. And typically the way to know if your porn is ethical porn, if it is a healthier sex-positive porn, is to pay for it. If you go to a site such as Erica Lust's site and subscribe, then you are getting a much healthier, ethical, sex-positive porn. So just to add that as well.
Thank you. Just one other question here from David I see about using toys reduces how good sex feels. You know, again, you're going to condition yourself to something. So sex toys can be fun. They can be incorporated into sex play with a partner. They can be used individually. And if you keep using them in the same way, you are going to develop a certain reliance. So it's good to stay diverse. You know, don't get conditioned to just one thing. Be diverse and use your sex toys, but then mix it up with a partner. and then you won't get locked into one thing.
Yeah. So I think that those were all the questions we had. Carol, can you remind us where people can find you, how they can get in touch with you, where they can buy your book?
Yeah, so hopefully my book is on Amazon. So I am Dr. Carol Clark. You can reach me at counselor@drcarolclark.com. My phone number is 305. I give out my phone number to everybody. Don't sell it. I'm pretty branded. You know, if you go to YouTube, I have a boatload of videos that I shot for Expert Village and Ehow Village. So Dr. Carol Clark, I'm trying to organize my own YouTube channels. And Amazon, just look for Dr. Carol Clark on Amazon, and there's Addict America and My Pocket Therapist. My Pocket Therapist, 12 Tools for Living in Connection. Connection is my thing. So Addict America, The Lost Connection, 12 Tools for Living in Connection. And those are my books right now. And then, of course, there's my schools. If you know anybody who wants to be a sex therapist or kink therapist or hypnotherapist, or transgender care therapist, look for that, look for my schools. And all of this, I talk about all of this a lot, train my therapists. And if you need a therapist, my website, therapy certification, certification.org. You can find, it has a find a professional on it, so you can find someone.
Thank you so much, Carol. And thank you to everyone who joined us today. We will be back next week. We're here every Thursday at 12:30. With us next week is Morgan Mayfair from Trans Social. So we hope to see you there. And thank you all so much.
Thank you, Melissa.
Bye.
Thank you,
thank
everyone,
you,
for hanging in there until.
Oh, no, thank you. Thank you for your patience. All right. Bye, everyone.